Hi, my name is Cam.
And I'm Merritt.
We are Pediatric Critical Care Fellows at the Medical College of Wisconsin, Children's Wisconsin. Thank you for taking the time to join us on this virtual tour.
We're excited to tell you more about the place and the people who are helping us to become excellent pediatric intensivists. The Children's Wisconsin Pediatric Intensive Care Unit is a 72-bed unit that spans 3 floors. Each floor has a similar layout consisting of patient care rooms, provider workrooms, conference and meeting rooms, as well as dedicated educational spaces. Our multidisciplinary teams work together to care for children with complex physiology, including medical, surgical, cardiac, burn, and trauma patients.
Each patient care room in our ICU is equipped to aid in efficient resuscitation, allow for technologically advanced patient monitoring, and can be converted to a surgical suite at a moment's notice. These private rooms also allow our patients' families to stay with them throughout their hospitalization. Our team is dedicated to the practice of patient and family-centered rounds. Parents, guardians, and patients are integral members of this team and are thus welcome to participate in our multidisciplinary rounds each day.
Within each floor of our pediatric ICU, there are multiple conference and workrooms of varying sizes. Larger conference rooms allow for team gatherings such as our fellow-led multidisciplinary team huddle, where we discuss the daily operations of our unit, including trauma, code blue, and rapid response team coverage. Other spaces allow for smaller gatherings, such as discussions with patients' family members or consultants.
All PICU fellows have secured badge access to an on-call suite that includes private bedrooms with computer and phone access, as well as private restrooms with showers. Our fellows have access to a quiet office space where they are able to work on their administrative and scholarly activities while on campus. This workspace offers docking station for fellowship supplied laptop computers, individual stations, business center resources such as fax, printing, and copying, as well as coffee and kitchenette access.
Children's Wisconsin is a Level 1 pediatric trauma and burn center. Our pediatric ICU fellows attend all Level 1 and Level 2 traumas. Upon arrival to the trauma bay, our fellows are responsible for the role of Doc Left, where we actively perform and participate in the primary survey, resuscitation, and procedures.
During the 3 years of PICU fellowship, you will gain invaluable experience as the medical control physician and as an active member of our pediatric transport team. As a fellow carrying the medical control pager, you will be responsible for taking both directly and indirectly supervised admission calls from our emergency department, our acute care floors, and from referring hospitals. As a first-year fellow, you will do a 2-week transport orientation where you will become familiar with our transport team and processes. Additionally, you will accompany the team on inter-hospital transports by ground via ambulance. During your 2nd and 3rd years, you will also provide coverage of high-acuity air transports, either via helicopter or fixed-wing plane.
Here at Children's Wisconsin, we are fortunate to work with dedicated critical care neurologists who are stationed right in our ICU. In addition to participating in the morning rounds of shared patients, we also review EEG and neuroimaging findings together. We also have the opportunity to do a 2 to 3 week critical care neurology elective. Each month, we actively participate in neurocritical care and CNS vascular conferences with our multidisciplinary team, including members of critical care, neurology, neuroradiology, neurosurgery, physical medicine and rehab, and infectious disease.
All PICU fellows participate in monthly critical care simulations within our dedicated pediatric simulation lab. These sessions are focused on building upon critical thinking and crisis resource management skills. Additionally, there are procedural workshops focused on skills such as ECMO management, central line placement, and airway management, along with biweekly in-unit simulations with members of our multidisciplinary ICU team. ICU fellows also have the opportunity to lead simulations for junior trainees and participate in other academic and scholarly pursuits within medical simulation.
The most valuable thing about my fellowship program is the nuanced system of support it has provided me during training. My education is supported by quality didactic sessions, simulation lab experiences, opportunities to participate in diverse committees and in research, and certainly it is supported by a variety of patients from whom I learn at the bedside. When I've needed an emotional or mental break from our demanding job, and when work-life harmony swings in the direction of home life demanding the majority of my time and energy, my program directors have been understanding and encouraging. As I've had realizations about how my career as a pediatric intensivist will be shaped and how it is unique to me, my co-fellows and attendings have listened wholeheartedly and helped me make connections with people and platforms that will ultimately lead me to achieve my individual goals. I truly feel part of an outstanding team here at Children's Wisconsin.
Throughout all of my training, I've never worked in a setting that was so supportive of its learners. Every aspect of the critical care team is always working hard to give us the opportunities to learn more. The teamwork exhibited throughout our units is also truly exemplary. With each new admission, there is always a full team there to support you, whether that be placing orders or helping stabilize the patient. It was so nice to be incorporated so quickly into this well-oiled machine. It allowed me to focus on patient care and gaining knowledge and skills. A program like ours is rare to find. Thanks for giving us the opportunity to show you more about our program.
We look forward to meeting you in Milwaukee.